Welcome to CityWorks, a co-production of the City University of New York School of Labor and Urban Studies and CUNY TV. I'm Laura Flanders. Each month, CityWorks explores the challenges and lived experiences of working people on the job, at home, and in our communities. This past winter's New York City nurse strike was historic, when in sub-freezing temperatures, 15,000 nurses walked off the job and onto the picket line. It marked the largest nurse strike in city history, and one of the largest in the history of the United States. We're talking about nurses from New-York-Presbyterian Hospital, Montefiore Medical Center, and Mount Sinai, Maine, Morningside, and West in the Mount Sinai system. It was also New York City's longest nurse strike, ending 41 days later when the last of the contracts was ratified. Those contracts include salary increases of more than 12% over 3 years, some protections against workplace violence, and the introduction of safeguards related to artificial intelligence. Yet some, including a sizable number of nurses, argue that the contracts fell short of resolving core issues, including unsafe staffing, overcrowding, and insufficient protections against layoffs. On this episode of CityWorks, we reflect on the historic New York City nurse strike of 2026 with some of the key organizers and leaders of the walkout. Judy Sheridan-Gonzalez is a Montefiore Hospital ER nurse. She's also former president of the Nurses Union, the New York State Nurses Association, or NYSNA. Beth Loudin is a neonatal nurse at New-York-Presbyterian Hospital and the elected president of the local bargaining unit there. And Goodness Iheanachor, a Mount Sinai Hospital nurse and elected member of the union's executive committee, will be joining us later in the program. All of our guests were on the bargaining committee for their respective hospitals, and I am very honored and happy to have you joining us now. Thank you so much for being here. Judy, let's start with you, and thanks for coming in.
Sure.
Just to emphasize the historic part, what was historic about this strike?
What was historic about it is that the nurses were so committed to show the employer that we were clear that we were not going to allow our patients to suffer in the context of what was going on in the nation and in the hospitals, and that we were very, very, very serious about ensuring that patients get what they need, and that we also are treated with the respect that we deserve as professionals and caregivers in terms of defining our practice and being able to do what nurses do best, develop relationships with patients and make a difference in their lives. The current healthcare system really doesn't provide for that. It's deteriorated in terms of our ability to do so. So a lot of our demands were definitely related to protecting our communities, protecting our own quality of life, including health benefits. There were insinuations and plans to harm our health benefits in at least two of the systems, and also to deal with the inequities in healthcare, certainly at the Bronx system, where our patients in the Bronx were treated differently than the patients in wealthier areas.
Beth, coming to you, no one goes into a strike lightly or without a lot of consideration. What drove you to it this time?
Yeah, there was really no option not to. As we got to the end of bargaining from August until December, we had been pretty clear with our employers citywide that we needed to stick to a timeline so as to not let this drag on and on and on. And so when the deadline loomed, the hospital still hadn't agreed to pay for, as Judy mentioned, the healthcare benefits for those not in the NYSNA benefits plan. So no nurse would be able to sign a contract at that point that said, we're okay with this and we will just go ahead and settle for what's on the table. It was very, very clear that the hospitals had coordinated a campaign against the workers, that they wanted to take an opportunity that would crush us. And they, I think, would say, we're pretty confident to say they miscalculated. They thought that they could coordinate a campaign that would drive nurses away from unionizing and being together as one. And my 2 cents is they really, really failed, and they underestimated us completely and entirely. And while the campaign and the strike didn't bring about like huge, glamorous, amazing wins that we're like shouting the rooftops, it was a stand for workers and against this corporate push to really fight workers actively and get rid of any sort of collaborative, collective voice.
Yeah. One of the things people may remember, Judy, is the big shout from the rooftops gains that were made in 2022 and 2023 coming out of COVID. And part of what this was about, as I understand it, was defending those gains. What did you see had changed in the way that the bosses, the management, were negotiating, were treating you compared to that period then? What was different?
Yeah, I think, it's horrible to say this, but I think there was a lot of ego involved. You have these extraordinarily wealthy CEOs who basically, in our opinion, see these hospitals and the whole system as a cash cow for their own wealth. And really, the concept of charity and the concept of academic medical centers have shifted now to the concept of making money and generating income. And so they were harmed last time. They underestimated us. We made incredible gains. And I think they wanted revenge. They thought, as Beth said, that they could outlast us, that we would only last 3 days if we went on strike. They were very well prepared. They kind of pushed us out on strike because for 4 months getting nowhere in negotiations, what are you supposed to do? As Beth said, we had no choice. We made no progress at all. They weren't doing anything. They were waiting us out and hiring these mercenary nurses at ridiculous salaries. What they paid for these nurses could have settled the strike easily, could have prevented a strike, and yet they wanted to crush us.
Take us into the room where it happened, Beth. You were on the negotiating committee there at New-York-Presbyterian. What did you see? What was it like? Was that your first experience of being there at the table?
I did sit at the NYP table again in the 2022-2023 campaign, where we did not go on strike. We did learn a lot in that process that did lead us to a different path this time in terms of making sure we are in lockstep with our brothers and sisters across the city, and making sure we are, communicating well and collaborating well. So we kind of knew who we were dealing with across the table directly from us in terms of who the hospital management and the lawyers that they use. But it was a little bit of a different tone, I would say, in terms of the lack of progress. We would show up, we would be ready, we would try and say, okay, today this is what we're going to talk about. We're bringing nurses, we're going to tell exactly why we need to improve this language or that language. And we'd really have our side ready and prepared, only to be faced with, oh, we'll take that back, or an outright rejection of any change to those language portions, or just really stalling behavior the whole period leading up to the strike. It didn't quite change immediately post-strike. As Judy mentioned, they were really ready, and they really wanted to just sit back and watch us suffer. It's been reported to me some things that were said that were very inflammatory from management's perspective. Like, let's see how they feel after 6 weeks out in the cold. And this was at the beginning of the strike. So they were very heavy on how much this is going to cost us as the nurses, and that we were the ones harming patients through this process. And they really wanted to drag us through the mud in many ways. But the difference here was that they actually collaborated across the city, and they all had the same playbook of let's sit back and let's not really negotiate for that long of a period of time.
So they were united, or organizing, as it were, across the city. How were you organizing across the different systems, the different hospital systems and hospitals?
Well, what was really powerful about this strike was that the rank and file, the members, got together, and their shock and anger at how the hospitals were treating us, because things started coming out, these kinds of comments, these statements, the understanding that we weren't just talking about our contract. We were talking about a whole healthcare system and a relationship between employers and workers.
Did I hear your health benefits weren't being paid?
As soon as the other hospitals went on strike, they ceased to have health benefits. Our health benefits ended in January. So by the time we were out on strike for a few weeks, nobody had any health care benefits. We were trying to set up free clinics. People were applying for Medicaid. People were applying for unemployment. I mean, people were harmed. So we felt there wasn't really, our story wasn't getting out there. We wanted our story to get out there, that we were really here to defend the patients and to defend healthcare and to create an environment in healthcare where we could give what we needed to give to save lives, to help the quality of life of our patients, and to do the things that people needed to survive. And so the rank and file took the lead, created these flash mobs, Grand Central Station, Brooklyn Bridge. We picketed at the governor's office because she had made a decree that could allow nurses without New York State licenses to work. There was this collusion between the governor and the hospital administration. Instead of saying, why don't you see what these nurses want? It makes sense. Why don't you negotiate? That did not happen from the top.
Mayor, Zohran Mamdani, came in, stood on the picket line.
Yes, he did.
Pro-labor.
He absolutely did. And Bernie Sanders was there and AOC was there. We certainly had our allies, but they didn't have the power that the governor had to influence the process. What really needed to happen was these CEOs needed to be contacted and told, you need to settle with people and give them the things that they need. It's not that much. We weren't asking for that much. In 23, we were, but not now. We just want to defend what we had won because it had improved the quality of life. For example, with the staffing language that we got in my hospital, they hired 500 nurses. Yeah. Hired 500 nurses, which gave us the safer ratios at my hospital, and it had a ripple effect elsewhere. So we were just really about taking care of our patients and being able to practice the nursing profession as we know it. With AI introduction, with certainly ICE was an issue. In my own hospital, a patient with tubes in his body was kidnapped by ICE. We said we can't tolerate that. I mean, we had issues that really, really were centered on patients and patient care.
And what about those patients and the community at large? Did they show up for you, Beth?
Oh yeah, definitely. Throughout, the long 41 days, you had various groups come out throughout. We had a handful of different unions, a lot of rank and file push there. And also a lot of our community groups did show up for us. And we had electeds walking the lines. I will say we had to push too, to make sure that our information was out there. We felt that we needed to really educate the union citywide what was going on, and that really a strike changes you. A strike changes anybody included in the process. And I wasn't on a strike before, but walking the line for somebody else's strike will give you some perspective for what your fight will be in the future. And so I would say that's a definite thing I learned through this process and would recommend for any unionized employee. We should really be supporting workers citywide. We've been able to see a few strikes in the city since our strike. And I think our nurses specifically have been like, how can we support? Where can we go? So the turnout for us was pretty good, but I think our nurses now are even more ready to support other workers in their struggles as well.
Watch out, world. What about what happens next? What are you working on at this moment? And what about those issues that remained unresolved from this strike?
Well, there are macro issues and micro issues. Mm-hmm. The macro issues is that the level of consciousness was raised among our nurses because people tend to be very insular, especially nowadays. So I think one of the things that happened was the nurses, as Beth was saying, saw bigger picture items. Yeah. We're part of a labor movement and we need to support each other. And it's very clear that the bosses have very different interests than we have. And that we are the defenders of not only what we do in our own quality of life, but the product that we produce. In healthcare, our product is our patients and our communities, which is why we had so much community support. So we want to keep that sense of power that the nurses had. They knew they outlasted the boss. Yeah. You could say, oh, was it a stalemate? No, we won. We won because they couldn't crush us. Their goal was to crush us. Their goal was to take things away from us. They didn't take things away from us. We got some gains, and they did not crush us. And that, we won. But what do we do with that win, right? So one of the things that we're trying to do is to figure out how do we, in the life of the contract, maintain that level of power, maintain that perspective that we are the people who deliver the care. Don't tell us what to do. We'll tell you what we need. And we're trying to build those structures in every bargaining unit and in every unit. Like, if you want to change a practice, talk to us. Don't institute something that's not going to work. And that's true for workers everywhere. And I think the most important thing about this strike is that we're in a position to win. We can't be outsourced. They can close hospitals, but they still have to deliver care. We're highly skilled workers that can't be replaced. We have a lot of power, and we have the trust of the public. Everybody's got a nurse in their family. Everybody identifies us. We've impacted so many people. So we can really help build a labor movement around the contradictions that exist, and also expose the inequities in the healthcare system and the need for a single payer system throughout the nation, and certainly in New York State, where there is legislation, which we are very much behind. Those things are really important to attack the systems that are harming people instead of helping people.
That's the New York Health Act.
We're at the center, the New York Health Act. We're at the center of that in our ability to say, listen, we need to change things. This is not working.
Beth Loudin, back to you at New York-Presbyterian. You saw some practices in the negotiations this time around that were pretty insidious and, well, the legality is questionable. What did you see, and how do you make sure this doesn't happen again?
At New York-Presbyterian, at our table, we were behind the other tables throughout the whole process, it felt. I felt our boss was dragging their feet the most. We hadn't had even discussions really about staffing, which was what a lot of this strike was about. So as the other table settled, the New York-Presbyterian team for NYSNA did not accept the mediated agreement. It came to our surprise, that was a hard decision to make, and
Sure.
Our members did find that difficult. I'm not going to gloss over that, but they also understood that we needed just a little bit more. We needed a little bit more on staffing. We needed a little bit more on job security, because New York-Presbyterian was the one to take advantage of the federal chaos and do layoffs as the richest hospital in the city. So we just needed a little bit more. We thought we would be able to get back to the table quickly and actually have a conversation where our voices were heard, and we needed to make a little bit more progress. It was a little bit of a surprise, to say the least, that then that agreement was then sent to our members instead about a day and a half later, if I'm remembering correctly, for them to go ahead and ratify on the same timeline as the other hospitals.
So the bosses basically did an end run around the committee. How do you stop that?
We hope that there would be some time to pause and reflect after this round, that we can't call bargaining committees crazy for doing the work that they are elected to do. We can't discount people that are doing this work for months and months and months on end, and years on end, to represent their local. So I think it is just a moment to, for all unions really, and rank and file leaders, to reflect that, is this allowable in your bylaws? Is this allowable in your LBU rules? To get nitty gritty, but also just to make sure your leadership is intertwined with your committees, the union-wide leadership, that they are, in discussions with you if there was a different decision to be made or a different path forward. So I think there is space to open that door wider and move forward in a better way.
Well, let's take a quick pause. We'll come right back. Thank you so much, both of you.
people of this country are sick and tired of the greed in the healthcare industry. They're tired of the drug companies ripping us off, the insurance companies ripping us off, and hospital executives getting huge salaries.
This is about safe working conditions. This is about a fair contract. This is about dignity. And New Yorkers know this because they see you, as Bernie said, in their times of need. And now is your time of need, where we can ensure that this is a city you don't just work in, but a city you can also live in.
Just some scenes from the historic New York City nurse strike of this past winter. This is CityWorks, and we're speaking with some of the key organizers and leaders of that walkout. And we're joined right now by Goodness Iheanachor, who is one of the nurses who was on the negotiating team at the Mount Sinai system. Goodness, welcome back to this conversation, or I should say welcome to this conversation. I'm bringing you back in, Judy. We've talked a lot about the heroics of the strike, how significant it was. You're all going to be in the history books, the longest, the largest. But I want to talk a bit more about the personal price paid for going on strike, like what you actually went through from the inside out. And Goodness, tell us a little bit about what it was like for you to actually take this decision to go out for as long as you did in the middle of the winter. What was the cost to you and your people?
So going on strike was not something that we wanted to do or we wanted to take lightly. Actually, there were so many opportunities for the strike to be averted. We started negotiating at Mount Sinai Hospital, October 3rd of 2025. From October 3rd up until the end of the year and into January, we were being stalled at the table. So there was no progress being made. We would show up at the museum and we would stay from early in the morning, the afternoon, till late with no progress being made at the table. And this went on and on. It was grueling because, of course, our members were actually fearing the inevitable. Like, okay, if the hospital and the union are able to reach an agreement, then they will have to go on strike. So we actually had to start educating our members, whether it's financially and otherwise, to how to best prepare themselves for what the unexpected.
I mean, just state the obvious. You're not getting paid. You don't get health benefits. What else?
There were people that were pregnant. There were mothers that were pregnant. There were people that had surgeries. There were people actually that were still, like where the hospital was the main source where they get their primary care. There were patients. There were family members of care of frontline providers that were getting their chemotherapy at the hospital. So it was very grueling. And, being on the executive committee, we kept our phones open. We would respond to messages, emails, calls, check on people, check on units. We were doing the best we could because it was as bad as it was for our members, it was bad for us because we felt like we were not no matter the best possible effort that we had to, make our employers know what was going on, we sort of felt that we were not doing the best we could for our members because we were just getting to a dead end.
Judy, there were also reprisals at Montefiore. At Mount Sinai specifically, there are some horrendous stories. What do you want to share?
Well, they trumped up charges. They fired 3 nurses. That case, I think, is still under litigation. And they disciplined and harassed and suspended members of the executive committee. This is unheard of. During negotiations, clearly these were ridiculous charges where nurses were giving information to other nurses and they were told they were violating some policy that was manufactured to intimidate and terrorize. It was these hospitals behave like terrorists. They were trying to terrorize the membership with all that kind of stuff that they were doing. And at the same time, people were freezing out in the streets. It was so cold.
Snow up to here.
Snow, blizzards, freezing temperatures, people not being able to make their car payments, their mortgage payments, feed their children. People were going to soup kitchens. It was humbling, which I think was a good thing, the fact that people were humbled. Well, this is what some of our patients go through. Yeah. My God, going to a soup kitchen, trying to get Medicaid, the humiliation of trying to get, unemployment insurance, all that kind of stuff, kind of brought us closer to our patients who were in that situation. But it was really hard for people. Yeah. And so people were going through all of that while these employers were, just bathed in money. Yeah.
Goodness, coming back to you, I mean, as you've described it, there's the stress of not doing your job, there's the trauma of hearing of the conditions in which your colleagues are working, there's the reality of what it's like on the picket line. Were you ever intimidated, scared, afraid?
The thing is, I would say I was not scared for myself because I'm from Nigeria. Yes, I was born in the States, but my parents are Nigerian. And we come from a country where speaking up, people get killed, people get abducted. Being in America, the freedom of speech and the freedom to fight for just cause, equity, fairness, I don't think that I will be doing myself or my members a good service of just keeping quiet. Even being on the executive committee, I was given a final warning. I was one of the people that were disciplined just because of speaking to coworkers, speaking to colleagues in the break rooms, away from patient areas, to update them on what is happening with our bargaining and negotiating process. So I was one of the members that was disciplined. However, I did not back down because I knew that I wasn't doing anything wrong. It also falls into that category of union busting. We were elected by officials, by our colleagues at the hospital. And I already knew that this is a commitment that I swore that I would abide by. And that was it. So yes, there was intimidation. But it wasn't something that made me stop. And that's it.
Well, thank you all for your work and for your struggle and for being the models that you are. Thank you, Judy, Sheridan-Gonzalez, Goodness Iheanachor, and Beth Loudin. Wonderful speaking with you. And that is it for CityWorks. If you have comments or questions, write to us at cityworks@slu.cuny.edu. And if you like what you just saw, consider making a donation to CUNY TV or to the School of Labor and Urban Studies Foundation at the links below. For CityWorks, I'm Laura Flanders. Thanks for watching.